the outbreak of Lassa fever in Nigeria.
Lassa fever. Lassa fever.
The situation has only become worse, with 109 deaths reported in 22 states.
104 Lassa fever deaths and 636 confirmed infections were recorded across the country in the first 2 months of this year.
I actually thought Lassa fever was out there, not too close to me, not until my younger sister, who is currently a medical doctor, contracted it through a patient she was seeing. And I can tell you that that was the most horrifying period for the whole family. I spent 7 days in the FMC and I was discharged home. But the day I got home, that was when, in the evening, just like 2 hours interval, an ambulance appeared in front of my house. And I was informed that it was for Lassa fever and I tested positive.
People are really afraid. People are running away from cases of Lassa fever to the extent that whenever we keep a suspected case of Lassa fever, everybody deserts the place.
I'm a Lassa fever survivor. My sample was taken at a particular time when I was on admission for a test. It was just like 6 weeks after I gave birth. And my mother was helping me to take care of my newborn. But when she informed the practitioner, so she was told to bring the child for admission. The result came that she was positive too.
Lassa fever is actually it's a deadly disease that has actually killed many people, but it's preventable. The cause of Lassa fever is a microorganism, which is a Lassa fever virus. And the agent is actually a kind of rat that has many breasts. But studies have actually shown that it's not only the rat with many breasts that actually carry the virus.
Lassa fever, the virus was first isolated and the disease was first identified in northern Nigeria. But here in Bauchi State, the first official case that was identified was in 2012. The disease was new to us, so it actually started with a period of panicking. The hospital management were finding it hard to get a staff that will attend to this patient because people were scared. They don't really know much about the Lassa fever. And around the initial times, we don't have adequate provisions of the personal protective equipment. We lost one of the doctors that was attending to the patient. And that also added to the fear that the staff were having. And then the second year in 2013 and up to 2014, we had a lot of other healthcare workers that became infected. And it also resulted in some mortality and significant morbidity.
The community saw this place as a place where they come in, you inject them with Lassa, and thereafter you put them in a place, and when they die, you go and bury them.
2 years back, there was some issues in one community where they are saying it's witchcraft.
Why usually this community link it to other spiritual interventions, not just infectious disease, was in some instances there will be like misunderstanding between two families, and then after those misunderstandings, Lassa fever will come into the community, and then it will be taking out one after the other, the member of the opposite family.
start from the secretary, who happens to be beside me. Mr. Secretary.
Information is power. Majority of our people, they don't know the consequence of this Lassa fever.
We went into the community, we advise and educate the community members on the infectious diseases surrounding our community.
So we're really trying to prepare this part of the world, so West Africa, ultimately to respond to epidemics, to future outbreaks with a variety of conditions. In this case, we're really focused on Lassa fever.
Even though before the advent of this aqua project, we've actually been having a kind of robust relationship with the people in the community. But this project has actually strengthened that relationship because we now have community advisory board members that are working with our community engagement team members who are part of the project at FMC Owo. So, and then we have a good rapport with even the traditional rulers.
We have
Our people are so conscious about Lassa, considering the negative effect on us. I think our people are now know what to do in preventing it. Clean environment, keeping our foods very safe.
We've been telling our people on the steps that they need to take. Number one, they have to ensure that they get rid of the rats from their houses. And then, number two, they make sure that they don't have dumping sites close to their houses.
These are the CET Federal Medical Center of Owo.
I put all my efforts to see how growing it and understand the motive, the reason why this CAB is being set up.
So among the things they do was to come around and see, and they said the CAB and the community should look for a dump site and try to move all the heap of sand, deaths and everything away from the community. So one of the things that we have really achieved that is paramount to us in the environment, in the town.
The way our people were trained on how to engage community is fantastic. That all the community around now, they now have better understanding of what we're doing.
Even at our own level, at the community level, we still go around to educate our people, to sensitize them.
In our own domain here, people tend to respect traditional leaders. So with him being he's a state chairman of health committee. So with him in the committee, there's the committee members and the communities are obviously listening to their word of advice. It's improving greatly.
You can't underestimate how important it is to really get community buy-in to these and other stakeholders within the community, government, health personnel, etc. Community engagement, has been a key part of this, developing, establishing community advisory boards, for example, which are representative. We've got representatives of the local community in them so that they can provide, direct advice so that people understand, what this research is about.
The participation of people when we go out to actually engage has significantly increased. People are now happy with us. People are now willing to partner with us.
By the time the first case was decided to come to this hospital and we are ready for the patient, we received the patient was successfully treated. We took this patient back to the community and we celebrated the return. And this patient now become the advocate of whatever we do here.
Yes, I mean, we've worked really very much collaboratively with colleagues at the centres where we've been developing capacity, so that you visited in Nigeria, for example, as well as elsewhere, building on the experience that we've already got here at MRC across all of those areas, so the development of physical infrastructure, so new buildings in which to do research and clinical trials, but also personnel capacity. At the end of the day, it's all very well if you have a building, but if you haven't got people experienced at research, again, that's a major limitation. Managing finances, managing contracts, managing data, community engagement. So really, the idea is through the expertise that we've already got at MRC, developed through really decades of research in this part of the world, we've really tried to support the building of that capacity in these other centres in Nigeria.
I'm a survivor of Lassa too, because I was once admitted into our infectious control ward when I contacted it. The infrastructure behind me is a clinical trial unit building, CTU building. The building, I believe, is a very vital building in this hospital, because this is where the trial vaccine for Lassa fever is to take place.
We have about 3 major benefits of this facility. Number one is, of course, the clinical training. We'll have a lot of resident doctors that will be trained here, like under the trial program. There are spaces where you can look at patients and even diagnose some of the disease. Apart from the trial program, you can still consult patients in the building. And then aspect of the laboratory, we can run a lot of laboratory tests. And then, of course, research and capacity building, because we have a conference room at the first floor. You can engage staff in capacity building and other training.
We started treating Lassa fever in Federal Medical Center Owo in 2017, and it has really brought a lot of changes into Federal Medical Center Owo, especially with the coming of AQUA, that is Advancing Research Capacity in West Africa. A lot of activities has really taken place since the coming of AQUA.
This kind of intervention now improve our capacity to do research and also to have the necessary infrastructure needed for research, as well as the manpower needed and the personnel that is needed for carrying out research.
The project, it impacted this facility in a way that our structure, our personnel, and the equipment that were provided are actually up to the global standard.
Our project has really helped us in terms of the trainings that we have received. Good clinical practice, good laboratory practice, biosecurity and biosafety, the method validation, and a lot of them has really helped us.
One key goal of this project is really to allow in the future, if there was a new epidemic of, for example, Lassa fever or other problems, to have research capacity in the areas of West Africa where that outbreak occurs, that we're able both to generate evidence so that we understand more about that outbreak, but also so that we can test new interventions, particularly vaccines.
Lassa, it doesn't have drugs, it doesn't have a vaccine at the moment. And the only way we can be able to do this is when our capacity is strengthened. And with the support of the AQUA project, now we are at the level, our capacity is at the level that we can improve testing and detection in the state, particularly for this pathogens, Lassa, monkeypox, and other priority infections globally.
When this CEPI-funded project came, it was like a eureka for me personally, because I couldn't imagine anyone having the same experience. We've had healthcare workers who have had, Lassa fever and who have died from it. So I don't see any reason why anyone should, contact the infection and even have to succumb by merely being a health worker looking and taking care of someone else. We thank God she's alive and doing very well now, but honestly, those days were really dark.
When I see it and I think about it, I'm always grateful that I survived. I'm always free to share my story, for it to serve as a source of strength for others, because it's not really a cool place to be. When you talk about it, it's not the same thing when you are the one experiencing it.
The one that I will never forget was a patient that came from one of the Lassa fever affected area in Tafawa Balewa local government with a history of fever for about 2 weeks. That news of having Lassa fever actually ravaged her. It makes her to have some psychiatric issues. And then when she came here, she thought having Lassa fever means she's going to die. She spent 28 days here, and she only ate on the last 2 days of her stay. And during that period of sickness, her boyfriend, who they're supposed to get married then in 2 months' time, actually called off the marriage because he doesn't really understand what Lassa fever is. He doesn't want to marry anybody that is having Lassa fever, so he has to call off the marriage. Within 2 weeks after we discharged her, she actually committed suicide. This also opens our mind that beyond the clinical care that our Lassa fever patient actually needs, the psychological aspect is as equally important as the clinical care.
We have a team of doctors, nurses that are well trained to manage confirmed cases that present in the hospital. And we have been doing that with excellent results.
In 2018, we had 24 healthcare workers infected within this facility alone. And among these healthcare workers, we lost about 3. It has significantly reduced to the extent that in 2024, we ended the year without a single healthcare worker getting infected. And even at this moment, after this moment in 2025, we have no healthcare worker in this facility that is infected.
CEPI's mission is really to have the capacity to generate a new vaccine if there's a new outbreak for a condition that we haven't seen before in 100 days. And in order to do that, you really need people who are able to respond very rapidly and with experience. And if you're going to a new part of West Africa that's never done any research, it's unrealistic to be able to test a new vaccine, for example, in that sort of time frame. So we're really developing capacity so that in the future, if there's a new outbreak, with funding from CEPI and through our support and support of the International Vaccine Institute in Seoul, really to be able to respond to that outbreak more rapidly and ultimately therefore keep people well and protect people from future epidemics in this part of the world.
We have now the capacity because the staff are now trained in terms of clinical research. So they now even question even those existing theories to really confirm that we are not getting it wrong, even at the initial phase.
We can make diagnosis early. We have a laboratory that runs samples on a daily basis. So within a few hours, the results, the PCR result will come out, and then we'll be able to take a decision on the treatment of the patient.
In terms of clinical trial, future clinical trial, we are now in a better position to really collaborate with any institution. We now have an area in our hospital where we now call Infection Control and Research Center that is more or less like a village where anything that we want to do along the line of research can be done there. And with collaboration, anybody that wants to collaborate with us have a very good room to really work with us.
When we got the funding as well as the intervention, we realized that we have to include a sustainability plan So what we did was the funding, we put some of the fund in establishing a bottled water plant. And this bottled water, we intend to sell it out to the public at a subsidized price. So that kind of intervention now makes it possible for the community now to access the bottled water at a cheaper price. And this fund that we are going to generate will now help us to push the money again into the system to improve research and also encourage the staff to attend conferences, attend some workshops, whereby their capacity now will be improved. Another area that we use the funding to improve sustainability is our oxygen plant. So the impact now is directly or indirectly affecting the community by having a subsidized table water, as well as subsidized oxygen to the neighboring hospital around us. And then we now sell the oxygen to the public at a much lower price.
I would say thank you, a very big thank you to MRC, a very big thank you to CEPI, and stating that we all hope that we will do our best to ensure that what we've learned has great impact, on us as individuals and a community at large.
Thanks to them. In fact, thank you is not enough to express how grateful I am to them.
Thank you, MRC. Thank you, CEPI.
This aqua project has really purchased a lot of reagents for us that we can boldly say if the vaccine trial comes, we are ready for it.
We are expecting vaccines and that it will be generally acceptable by our people so that they get immune. So they get vaccinated and eventually get immune against it.
If we have a Lassa-free environment, it's going to be a great thing that not to us alone, to the whole world at large.
To me, it's something that I should celebrate if we can, at the end of the day, have vaccine that will prevent Lassa fever.
Vaccine is the answer. And so all hands must be on deck to really make sure that we develop vaccine against this scourge.